It's an honor and pleasure to share this stage with you all and do a kind of reflection that one doesn't get to do very often. Talk about failure in public, in front of a lot of people. So I'm a social scientist. I'm a health policy and systems researcher, as per the introduction. I've been working and thinking about policy engagement based out of India for about 15 years. Now, in the scheme of the range of experience that is represented in this room, I already have imposter syndrome, and I'm really looking forward to hearing from you all in conversations and even in Q&A what your take on all of this is. And as Nasreen said, and Patrick also said, that this is all about storytelling. And what I want to talk about is stories that we tell ourselves. And these are the stories that I've told myself in the course of trying to do policy engagement. And I started this, as most scientists should and do, with scanning the evidence, with doing the research on how policy engagement works. And then I started failing and failing and failing. And there was thought bubble after thought bubble. And so what I'd like to do is talk you through 4 of these thought bubbles. And as I do this, we will go higher and higher into the atmosphere. Now, I wasn't going to do this, but let's try it. Each of these thought bubbles, I'm going to say thought bubble, and I'd like you to go pop. Okay, shall we practice? Thought bubble, pop. Thought bubble, pop. Okay, let's see how we go. All right, so conventional evidence on policy making that I studied suggests that you can use materials and ways of communication like evidence briefs and briefings to communicate the science around a particular area, right? You can create evidence gap maps. You can have institutions embedded in policy-making exercises and ministries and so on. You can also have whole knowledge translation platforms. These have been studies, they've been established over a very long period of time. So in India, of course, we tried everything. We tried all of these. I was lucky enough to be involved with all of these, and I have stories of failure from all of them. So I will be sharing those with you. Now, at the individual project level, the sequence was conduct research, develop findings, disseminate, create policy brief, and share with decision maker, right? Wrong. I think most of us know that this is wrong, and we've had many conversations already at this summit that this is not at all how things work, right? Policymakers at the local level, all the way through up to ministers and bureaucrats that I've tried to do engagement with, they're not jostling and dealing with just me. They're dealing with a whole ecosystem of other actors and priorities. They're not just interested in the primary healthcare model I want to talk to them about, or the injury programming that someone else is talking to them about. They're dealing with what they want to be known for. They're dealing with what they feel the community's needs are, or the needs that aren't articulated, how to even find those out. Or they're trying to deal with a politician's pet project, right? That's what they're navigating. So, thought bubble 1, pop. There are lots of stars in the sky. You're not the only bright, shining star, right? So we have to be mindful of the fact that policymakers are in an ecosystem where they have lots of these stars and they need a map to figure out what's even happening. Perhaps evidence synthesis can help with this. We make gap maps, for Pete's sake. We make actual maps for people to be able to navigate what they're doing. And when we have done this, for instance, through the creation of a rapid evidence synthesis unit in India, it happened to be during COVID. And we were answering bespoke questions, not our questions, but questions posed by a national health agency that was advising the government. And we had questions from the national level, sub-national level, really working through weekends, rapid synthesis of evidence. And what did we find? We found that we couldn't answer a lot of the questions they had, right? I think this is a familiar feeling for many people. We couldn't answer questions about scale, about adaptation, about sustainability. Thought bubble 2. There are black holes. There are dark spaces. There are bits of knowledge we can't provide in the process of what we're doing in our policy engagement exercises, right? There's a lot of sub-stories within that story, but in the interest of time, I'll keep going. But it's also important to acknowledge that whether during a pandemic or in the general course of policymaking, policymakers are interested in evidence. Of course, they want it on their terms, from a person they trust, from institutions that are reputed, and on their terms, right, as I said. And we studied this in 2012. We put together a report comprising research on institutional embeddedness. So that's this idea that institutions are embedded in ministries or within the framework of policy making. And we found that there were four, based on the science, there were four features that mattered. Capacity of institutions, reputation of institutions, the quality and the quantity of interactions between researchers in those institutions and policymakers across levels of the system. Okay, so these are asymptotes, right? You never really achieve this level of capacity or cross some sort of threshold of reputation. You just keep going and going and going. You do your best. And so we tried this. In a southern Indian state over a period of 5 years, we tried to be institutionally embedded in primary healthcare processes, reform processes. There had been a new reform introduced. And from the highest level, one of our important brokers or nodes in our policy engagement process was the top bureaucrat in government. And they were really accommodating. Of course, they changed our research question, but we could handle that in our funding. And we had a great deal of engagement back and forth, back and forth. And it really felt that we were getting somewhere with our embeddedness. We were learning from each other. Reputation, capacity, quality, quantity, all of this was going up. And then he retired, right? After he retired, he was succeeded by another bureaucrat who by design, by structure, had to distinguish himself from the earlier bureaucrat. Right? He had to reset all those relationships. He had to question our institutional embeddedness, right? Thought bubble 3, constellations shift. So the constellation, the cast of characters that was involved with that policy engagement shifted. And I began to notice my own positionality in this constellation as a woman, as a person of a particular socioeconomic background, location, vocation, right? My positionality in this constellation was also ever shifting, and therefore also the possibilities of policy engagement. But surely, policy engagement should be more than just the set of institutional or individual relationships. Surely many of us have tried to create whole platforms, knowledge translation platforms. And we actually studied this in Health Systems Global in 2016. We put together an inventory of different knowledge translation platforms. And in fact, in India, from even before that time, there have been efforts to create a knowledge translation platform. And it's been created and then broken down, and then reformulated, and then changed, and then restructured, and then someone left. Okay, so it's been kind of transforming, but through that there have been meetings, there have been exchanges, there have been interactions, there have been websites, inventories, things like that. So is that a sign of failure or lack of sustainability? Or is that something else? Maybe it's something else, right? Thought bubble 3. No, 4. Constellations actually cohere as galaxies. What we were seeing as repeated failures were repeated attempts, motivated by a kind of gravitational pull of all of us to each other. So many of these meetings and reconfigurations, it was the same people coming back together, held together by relationships of trust, by persistence, and by radical honesty. And I think many of us have been talking about that. There is this pull towards exchange, towards knowledge, towards sharing, right? And so I just want to re-summarize these 4 ideas and then end with a last thought. So here are my 4 thought bubbles again to summarize. 1, there are many stars in the sky. There are many of us engaging in policy spaces with context ever lurking, ever changing, the relevance of what we study and what we advocate, how brightly the evidence shines, if you will. 2, even with these stars, there are gaps. There are black holes, there are dark spaces, there are expectations we cannot meet, there are questions we cannot answer. That's important. Sometimes we may never answer them. 3, constellations shift. The configuration of actors, including ourselves, are ever moving, ever repositioning, as should be our framing and understanding. And lastly, 4, not 3, 4. We may be moving, but we are actually held together by something quite powerful. These relationships, these gravitational pulls of trust, and as I said, persistence, integrity, and honesty. So you've seen I've used a lot of astronomy metaphors, but I feel there's something to be learned. In the course of my own lifetime, Pluto has gone from being a planet to a dwarf planet. We must entertain the possibility of radical reframing of how we view the work we do in use and translation of evidence. And I'd like to suggest one small idea there, that it's not per se use of evidence. It is exchange of knowledges. And from these various vantage points, whether as stars, black holes, constellations, or galaxies, the types of exchange that we engage in vary. The types of conversations we have are different. And they all require us to pop these thought bubbles, to think about what they suggest for these relationships and interactions for engagement. And in my view, that popping of thought bubbles and that assumption, that recognition coming face to face with failure, with entropy, with uncertainty, that's one of the most scientific things I can think of. I hope you agree. Now, from all of our space metaphors, I think we're going to hand over to Laura, who will talk about cultivating reflexivity with our feet firmly planted on the ground. Right, Laura? Okay, over to her.